We want to thank you for joining us here tonight at 10. I'm Sharon Chen in for Brad and Lauren. Expecting moms will have one less place to get care in the metro. Research Medical Center's parent company says that the hospital will close its NICU and end its OB program in 2 months. It's the second hospital to make that move in a little over a year. Providence Medical Center in KCK ended its program in June of last year. And a midwife birthing center also closed, citing low insurance reimbursement rates. Tonight, KCTV5's Betsy Webster joins us live from the newsroom. And Betsy, really, there is a bigger picture here for moms.
Absolutely, and I want to get into that in a second, but first I want to talk about research. Parent company HCA said that the demand for obstetrics at research has gone down 80% in recent years, but it's specific to that location, which they say is also seeing higher demand for services like cardiac, emergency, and trauma care, which they say are things that location among all of theirs is best equipped to expand. Plenty of places in the metro are seeing an increased demand for obstetrics. North Kansas City Health says its programs continue to grow. University Health said they delivered nearly 3,500 babies last year, a nearly 5% increase over the previous year. And the University of Kansas Health System says it's also seeing a growing volume, particularly in transfers, with an upward trend for high-risk pregnancies. Here's their OBGYN chief.
Patients have more medical comorbidities. Patients might be older than that they were. We're seeing more diabetes, more hypertension, more obesity, and all that leads to complexity.
HCA still offers obstetrics at its other 3 area hospitals, Menorah and Overland Park Regional in Johnson County, and at Centerpoint in Independence. What worries Dr. Winicky is that this isn't the first closure. State hospital associations note that labor and delivery floors have fixed costs with specialized care, which grows more and more expensive to run when fewer patients use them. One reason maternity deserts are plaguing lower population rural areas. Jackson, Wyandotte, and Johnson County still have many options, but for those with limited transportation, clustering care in fewer locations can become problematic.
Obstetrical care isn't a one-time visit. So, if it's a surgery for your gallbladder, you go, you get it taken care of, and you're done. Obstetrical care could be 10 to 12 visits plus ultrasounds over the course of a period of time. So anytime you're asking a person to travel longer for multiple episodes, I think that puts a big burden on our patients, which is going to be difficult for patients to maybe even seek out care at all.
Now, HCA and its providers are actively reaching out to the obstetrics patients at research to connect them with alternative locations in the community and also within the health system. Winicky warns that if you do choose to shift, especially to a different healthcare system, you should do so promptly. Betsy Webster, KCTV5 News.
I'm sure that's hard news for a lot of expectant mothers to take out there, but it's good to know that there are alternatives. Thank you so much, Betsy. And Kansas City Mayor Quinton Lucas is reacting on X. He says in part, quote, "We will work to ensure access to top care for all mothers and babies."